Welcome to Keiser Voices, the story of success, brought to you by Keiser University Graduate School, here where the academic world meets personal triumph. Join us today as we dive into the captivating tales of success.
Welcome back, everybody, to another episode of Keiser Voices. We're excited to continue our Mental Health Month conversation, and joining us today is Miss Julie Owens. Ms. Owens is a community educator, advocate, and volunteer for the Alzheimer's Association. Ms. Owens, we're so excited that you could take the time to join us today.
Thank you, Heather, and I'm so glad to have this opportunity to be here. And thank you to Keiser for bringing awareness to mental health.
No, it's our honor, really. We're excited to continue our conversation with our topic of mental health and aging, and really taking a look at understanding dementia, cognitive decline, and the role of the caregivers, which is often not a subject we talk too much during Mental Health Month. But Ms. Owens, what can listeners do, I think, to improve or maintain cognitive function as they age?
So, the science on dementia and risk reduction is constantly evolving, and there are certain risk factors that can be modified, and along with promoting healthy behaviors. And this, along with other things, can help reduce the risk of cognitive decline and possibly dementia. For the Alzheimer's Association, we have on our website, alzheimersalz.org, 10 healthy habits that we really think that is recommend. On our website, alz.org, we have 10 healthy habits that will help to unpack your brain and public health your awareness. And this is a public health campaign that the
Mm.
Alzheimer's Association has launched. Just to name a few of these 10 healthy habits, you can, number one, challenge your mind. With that, making sure that you constantly put your brain to work, exercise your brain, and that is tackling maybe something that is new, tackling something that may be a little bit more challenging, or actually learn a new skill. And this will help to
Mm.
challenge your mind. And we're talking about brain health. Second is move, right? So get moving. And with moving, you can do regular exercise, activities that will help to raise your heart rate and increase blood flow. And this will increase the blood flow to the brain, and it will increase blood flow to the body. Another tidbit is be smoke free, right? Quitting smoking can help reduce the risk of your cognitive decline. And there are other healthy habits that we definitely have on our website, and can give you references like controlling your blood pressure,
Mm.
managing diabetes, and eating right.
So, taking a lot of the steps that your physician probably usually talks to you about, and being mindful of them sounds like would really help to improve that function as you get older.
Absolutely. And again, these are not 100%, but it
Hmm.
definitely can help to reduce the risk of dementia.
So when we talk about dementia, there's a lot of, I think, confusion for some people where they think dementia and Alzheimer's are the same thing, but they're not. They're two different cognitive uh, diagnoses that can present, and not just the elderly. There have been multiple cases of people in their 30s, 40s. So shouldn't just be associated with the elderly. But what are some of the early signs that, to be aware of for Alzheimer's and even the other forms of dementia?
So, Heather, you bring up a great point about the confusion with dementia and Alzheimer's. Well, first, just to be very brief and um, broad term of dementia, that's the broad
Hmm.
term. And what that is decline in cognitive function. Alzheimer's is a specific disease, and it is the most common cause of dementia. So that's the difference between the two. So there are various forms of dementia. But to answer your question about the early signs of Alzheimer's and other forms of dementia, and Alzheimer's is a brain disease, and it can definitely cause a slow decline in memory and your thinking and your reasoning skills. And the most common cause of dementia, which is the general term, like I mentioned, which is memory loss. So some warning signs of memory loss, it can disrupt your daily life. And there's challenges when with planning, or there's challenges with solving problems, difficulty doing familiar tasks, and you have confusion with different times and with different places. And when someone starts to notice an individual or their loved one that has these different signs, they start to experience some kind of frustration
Mhm.
and denial, and um, it can be, they may find it hard to recognize that they actually have the problem, but it's more obvious, most likely to family members and to friends.
What's the impact this has on somebody's emotional well-being?
Wow. So for someone that is diagnosed with Alzheimer's, it's coming to terms with the fact that they have been
Mhm.
diagnosed with Alzheimer's. And not only that, embracing changes to their emotional state. So they will continue to experience and have these unwanted feelings and emotions, and they are not really familiar with how to display that. So at times, the emotional state and responses might be symptoms of
Mhm.
Alzheimer's. And again, there's that frustration, there's that anger, there's that confusion, and having to learn how to control their emotions.
One of the reasons why we felt that this conversation needed to be had during Mental Health Month was one thing that we don't often talk about is the families and the caregivers, right? We hear about what that individual is going through, but they're, even though probably to them they feel like they're going through it alone, especially as the cognitive decline continues, but the family members and the caregivers are on this journey too. Can we talk a little bit about the effect, especially when we talk about emotional well-being, that it has on the families or caregivers?
Absolutely. So we know that caring for someone with any disease is overwhelming, but
Mhm.
Alzheimer's in particular can be very overwhelming, along with the family member having other responsibilities. It can be very taxing on them with their loved one being diagnosed with Alzheimer's. So it's very important to make sure that the family members have a support network and that they can remember to continue to take care of their own well-being. So with those responsibilities that they'll now have with caring for someone with Alzheimer's, we want to make sure that they do not neglect taking care of themselves. The best thing that that family member can do is to stay physically and emotionally strong.
And a lot of my questions come from personal experience. My grandfather passed from early onset. He had a traumatic brain injury that exasperated that, was diagnosed with dementia and Alzheimer's. And so I watched my aunt and my mother, caring for their parents. And they had to take over the finances. They were keeping track of who was on what medicine, when the doctor's appointments were, and meanwhile, my mom worked full time. My aunt was retired, but she had her own, um, doctor's appointments, medical attention, anything like that too, and their own household financials, and they're taking on now this individual, and I think we often sometimes think that they did not want to not do that for them, but that's a lot, like you said, that's a lot for that individual.
Heather, you are correct. It's a lot. And I too have that experience. My father was diagnosed with Alzheimer's in 2021, and he recently passed away December 12th, 2024. So I too know what, as a family member that had a loved one that suffered from Alzheimer's disease, it can be extremely taxing. So, learning how to manage your stress level is extremely important because stress can cause physical problems within your body, right? And then second, be realistic about
Mhm.
it. It's a difficult diagnosis and it's a difficult time, but the care that is provided can definitely make a difference. And um, you can help with controlling those behaviors. Grieve the losses, but also at the same time, focus on the positive times that you have with them and enjoy those good memories. And remember that you are doing your best. And like you said, I know your mother and your aunt, they did the best that they could. My mother, my sisters, myself, we did the best that we could. And just remembering that the care that is provided, um, you may feel guilty
Mhm.
at times because you feel like you could do more, but providing that individual care for your loved one that has Alzheimer's, the needs will change over time because as progresses, the needs will definitely change. And remember to take a break. It's
Mhm.
okay to take a break. It's normal. No one can do it all by themselves. And it may be a time to look into that respite care to
Mhm.
allow yourself to be able to take that break.
Yeah, I think that's important too, like to not be afraid to say that you need help. I mean, there are senior facilities that have memory care whole divisions that where they're very educated on what that journey looks like and what the family needs too. But what other opportunities for support do caregivers or family members have? I know Alzheimer's does a lot of education services on caregiver resources.
Absolutely. Well, number one, our website, alz.org. And then we also have a 1-800 number, 1-800-272-3900. It is open 24 hours a day, 7 days a week, 365 days a year. That's a good place to start. Second, we do have plenty of support groups. So we have groups, we have them virtually, and we also have them online. Our particular chapter, the Southeast Florida chapter, here we are very present in the community with offering education in the community. We visit facilities that are age 55 and over. And not only that, whenever there's a request to have a presentation,
Mhm.
if you're having an event, that's something that you can reach out for as well to have some education that's provided to the community.
Much like what we're doing here today, we connected with the Alzheimer's Association to get in touch with a community educator and advocate so we could have these conversations.
Absolutely. Absolutely. And we're glad to do it.
So, what are, do you think, some of the biggest mental health challenges that caregivers face? So they know what to ask for help with.
Okay. Some of the biggest mental health challenges are um, frequently experiencing high levels of stress of what we just talked about.
Mm.
And we know that caregiving is hard. We've already talked about that, and it can definitely lead to stress. It can lead to guilt, anger, sadness, isolation. All of those things are encompassed, and it can be very taxing on an individual's mental health. But one thing is not to be in denial, right? So seeking out that help if you need that help, if you want to speak to someone that you trust, a trusted friend or a trusted professional, absolutely have those conversations to make sure that you're taking care of your mental health. Again, avoiding the state of depression, because that can happen and that's
Mhm.
common in caregivers. So seeking out that help to make sure that you have someone to talk to.
Now, before we let you go, I think it would be poor of us not to spend a few minutes talking about the Alzheimer's Association. It's near and dear to my heart. I also serve on the longest day committee for Southeast Florida. So I'm out there in the community as well, talking about Alzheimer's and the work that they're doing. But can you tell us a little bit about, for our audience, about all the different things that the Alzheimer's Association does, both in support and education and research?
So absolutely. As I mentioned, we have support groups. They are virtual and they are in person. We host local education programs for the community when requested, if needed. Again, our website is alz.org, and our 24/7 hotline, 1-800-279-3900. And what's interesting about our hotline is that we have specialists and master's level clinicians that can provide confidential support and information. So definitely take advantage of that. And also advocacy. And you can join with our group and advocate for different bills that are we're hoping to be passed in legislation. We were very successful with having a bill passed where it is the Alzheimer's awareness campaign in the state. So stay tuned for that awareness campaign to be front and center. It'll be by social media. It will be by however we feel fit. Our social awareness campaign is forthcoming, and just be on the lookout for that. And then lastly, our walk to Alzheimer's. We have it in the fall. We have it in across various locations of South Florida. It's a great way to connect with other caregivers and others that are facing the disease. And if you want to locate the nearest walk for you, if you want to locate where the nearest walk is for you, alz.org/walk. And you can definitely find out more information about the Alzheimer's Walk.
Awesome. Thank you, Miss Owens. And we're going to be including the link for the Alzheimer's website in the description below this podcast recording. So this way you can also maybe look for opportunities to connect with the local chapter by you. You know, you can find the Alzheimer's Association in every state, and it's a great opportunity to advocate, to learn more, and even just for support. So thank you, Miss Owens, for joining us today.
Thank you, Heather. I really appreciate the opportunity to speak to you, your audience, about mental health and Alzheimer's. Thank you.
And if you guys have enjoyed this conversation, be sure to like, share, subscribe, and follow as we continue all month long talking about mental health. We'll catch you on the next one.
Thank you for journeying with us today on Keiser Voices, the Story of Success. As we close this chapter, remember every story has its next page.